From the front lines here at Lehigh Valley Hospital, Pocono, to the essentials like the grocery stores, face masks are now being used to help slow the spread of the coronavirus. The experts, including Jennifer and Ashley, nurses at the hospital in East Stroudsburg, want to set the record straight on proper mask use.
For the general public, they recommend that you just wear a cloth mask. And for healthcare workers, we have two different types of masks. We have a surgical mask and we have an N95 respirator. And depending on the type of care that the patient is receiving will depend on what mask that healthcare worker should be wearing.
These nurses have become accustomed to wearing personal protective equipment, or PPE, while they help treat patients battling COVID-19. Both the Centers for Disease Control and Pennsylvania health officials suggest face masks can help flatten the curve and save lives.
So the mask is supposed to cover your nose and your mouth, and if you were to accidentally sneeze or cough or even talk to somebody else in public, it kind of keeps all of your secretions contained so that you're not exposing somebody else to your secretions.
These nurses want to remind everyone the N95 masks should be reserved for healthcare workers only. And if you are wearing a cloth mask, there are some simple tips for using it properly.
You want to hold it by the ear loops and put it on your face. And you want to make sure that it's covering your nose and your mouth at all times. Once it's on, you don't want to touch it with your hands. If you need to adjust it, when you're done, you want to wash your hands or sanitize them.
Then put the mask in the washing machine. Another tip from the pros, gloves are not recommended, as healthcare experts say they provide a false sense of security. Ashley demonstrated it for us using red paint to signify how the virus can spread even with gloves.
You go to the grocery store, you go to the produce section, you pick up a banana. Pick up the banana, you kind of look at the banana, kind of like, oh yeah, you know, this is a good looking banana. You put it down. Then all of a sudden you get a phone or a text. Your phone's in your pocket. You reach into your pocket, pull your phone out, and you're texted.
Because the gloves aren't helpful to prevent the spread, these healthcare providers stress the need to wash your hands and use sanitizer rather than gloves.
Next thing you know, like as you can see, now I am covered potentially in the virus without even realizing that I've contracted it, and I'm wearing gloves. There's no difference between wearing gloves or not wearing gloves. The biggest thing that we recommend is wash your hands and sanitize your hands.
And if you must go to the store or pharmacy, these experts suggest going when there are fewer people out in public, like the evening or early mornings. All simple steps we can take to help flatten the curve and save lives. Jim Hamill with the Pocono Television Network in East Stroudsburg.